Good morning, class. So today we are going to discuss consumers' health. Consumers' health pertains to the aspects of wise purchase of health products and services in order to obtain the ultimate satisfaction and wellness of the body. Now, class, how important is consumer health? So people consume goods and services and gifts of nature their day-to-day existence on earth. So we need food. Aside from that, we also need clothing. It is with this reason that people should be aware of the vital topics to be educated about the preventing medicine and services in order to achieve good quality of living. Since we consume a lot of things for our needs, consumer health provides individuals with knowledge, skills, aptitudes, values, and capacity to become responsible consumers. Now let's find out who is this consumer. So these are the person who purchase goods and services for personal use and not for business purposes. So being said that consumers are us, the one who buy goods, the one who buy everything that we need. So as a consumer, you also have rights. And we have 8 rights for our consumers. And we are going to discuss one by one. Aside from having our rights, we also celebrate these events. So the National Consumer Right Date is observed across India during December 24, 2013, while the World Consumers Right Day is observed every March 15. Right to basic needs. To have basic goods and services which guarantee survival, like food, clothing, shelter, healthcare, and education. So, this is basically telling you that you have the rights to buy anything you need for yourself or your family. Now, let's go to right to safety. To be protected against products, production process, and services which are hazardous to health or life. So they are agencies in the Philippines that are responsible for keeping us safety, like Bureau of Food and Drugs Administration. Now let's go to right to information. Right to be given the facts that are needed to make informed choices or decisions, to be protected against misleading advertisements or labeling. So there are misleading advertisements that you can see on magazines or on televisions. And this advertisement will just tell you to buy their items without giving you more facts of their items. So you have to research and know what you're going to buy. So let's go to right to choice. Right to have access to variety of products and services at competitive prices with an assurance of satisfactory quality and safety. So this means that you have rights to choose anything you want, right to buy items you want, right to have satisfactory quality and safety of the product that you are going to buy. Now let's go to right to representation. Right to be represented so that the consumer interests receive full and sympathetic consideration in formulation and execution of economic policies. So as a seller, the one who is selling, they should represent their product well so that they can catch the attention of a consumer. So right to redness. Right to be compensated for misrepresentation, shoddy goods, unsatisfactory services. So this is basically telling you that the seller has the right to compensate you if their products are fake or if you're not satisfied with their products and services. And right to consumers' education. Right to acquire knowledge and skills to be informed consumer throughout life. That's why today you are learning about the rights and consumers' health. Let's go to right to healthy environment. Right to physical environment that will enhance the quality of life. So you have to make sure where you're buying your items, they are healthy, clean, and safe for you as a consumer. So let's talk about health fraud. Health fraud is the dishonest promotion, advertising, distribution of sales or articles claimed to be effective in diagnosing, preventing, curing or treating an illness or condition, or proven a beneficial effect on health but have not been scientifically proven, safe, and effective. So there are a lot of products in the market that are claiming that their products are safe for your skin, may it be for your health or your body. But they are not FDA approved and there are no scientific evidence that they are proven safe and effective. So let's go to the three components of consumers' health, which are health information, health products, and health services. So, health information refers to the data and facts about health products and services you get from media, people, including professionals and agencies. So, these are health related products that you can hear, watch, and see in magazines, in radio, and in media. Now let's go to health products, which are the food, the medicines, cleaning agents, and personal care. So let's go to number one, which is food. Food is the substance consumed to provide nutritional support for the body. It is usually of plant or animal origin and contains essential nutrients such as carbohydrates, fats, protein, vitamins, or minerals. Eating a wide variety of nutrition-rich food is best way for most people to obtain the nutrients they need to be healthy and reduce the risk of chronic diseases. So these are the foods that you buy from the grocery like meats, vegetables, and fruits. Now let's go to number two, which is medicine. Medicines are any substance used in treating disease, injury, or illness, medicament, or remedy. Medicines comes in any form, such as tablets, liquids, inhalers, drops, patches, creams, lotions, suppositories, and injection. Some are taken by mouth while others are applied in parts of the body. So examples of medicines are the COVID vaccines, the paracetamol, the biogesic, those are medicines. So let's go to number three, which is cleaning agent. So cleaning agents are usually liquids, powders, sprays, or granules. They are used to remove dirt, including dust, stains, bad smells, and clutter of surface. Purpose of cleaning agents include health, beauty, absence of offensive odor, avoidance of shame, and avoiding spread of dirt and contaminants to oneself and others. Some cleaning agents can kill bacteria and can clean at the same time. So examples of these are Zonrox, Tide, Downy, and any cleaning materials that you have seen on your house. Now let's go to the last health product, which is personal care. So the personal care include products as diverse as lip balm, cleansing pads, cologne, cotton swab, cotton pads, deodorant, eyeliner, facial tissue, hair clippers, lipstick, lotion, makeup, nail files, shaving cream, wet wipes, and many more. So these are products that you often use on your body. So let's talk about health service. So if we talk about health service, we are talking about the dentist, the dermatologist, the dietitian or nutritionist, the nurse, the ophthalmologist, the pharmacist, the psychiatrist, and the radiologist, and social workers, speech therapists, and surgeons. So health service promote practitioners to new vaccines, tests, and therapies to treat diseases that once posed a serious health risk and enhance consumer health. So let's talk about dentists. They are also known as dental surgeon. A dentist is a healthcare practitioner who specializes in the diagnosis, prevention, and treatment of disease and condition of oral activity. Now let's go to dermatologists. A dermatologist can diagnose and treat disorders of skin, mouth, external genitalia, hair, and nails such as the skin cancer, moles, allergic disorder, and scarring. Now let's go to dietitian or nutritionist. A nutritionist is a person who advises on matters of food and nutrition impact on health. Now let's talk about nurse. Nurse receive special additional training to perform physical examinations, make diagnosis, and prescribe treatment, often and under the supervision of the physician. Now let's talk about ophthalmologists. So, ophthalmologists can diagnose and treat problems related to the eye of the vision, including vision correction with glasses or contact lenses, and treatment of disease such as glaucoma. Now let's talk about pharmacists. A pharmacist mixes and dispenses medications. And we also have psychiatrists. They are the medical doctors who specialized in the diagnosis and treatment of mental disorders. And we have radiologists. So they make use of radiology methods such as X-ray, ultrasound, and nuclear medicine, diagnosing and treating diseases using radiation. We also have social workers. They help patients with matters such as finances, insurance, and family problem. So we also have speech therapists. So they are the one who treats and help preventing disorders related to speech. We also have the surgeon. A surgeon is a specialist in surgery. Is a broad category of invasive medical treatment that involves cutting of the body. So let's talk about what government agencies provide health service for the consumers. There are government agencies that provide health service and protect the welfare of the consumers. These agencies aim to make the people healthy and to prolong life expectancy. So we have Department of Health, or also known as DOH. We also have Philippine Health Insurance Company, or PHIC. We also have Department of Trade and Industry, or also known as DTI. Then Bureau of Food and Drugs, or also known as BFAD. We have also Department of Social Work and Development, or also known as DSWD. Philippine Dental Association, or PDA. And lastly, we have Philippine National Red Cross, or also known as PNRC. So those are the Philippine agencies that provide health services to the consumers.